Hi, I'm attorney Paul Samakow, and I have the pleasure of having here with me today Dr. Daniel Markmann. He is a national, if not internationally renowned, board-certified plastic surgeon and an expert beyond any that exist on a procedure called the Brazilian butt lift. I am thrilled to have you, in front of me, Dr. Markmann. It's an honor. Would you kindly give us just a bit about your credentials, and then I want to ask you about this BBL procedure.
First of all, I am a board-certified plastic surgeon. I've been in practice now for about 26 years. I was one of the first two docs in America doing BBLs as far as I and the other doctor are aware of. I started doing BBLs about 25 years ago. There was another doctor down in South Carolina. He was doing the same thing, started on his own. I started on my own. We were doing a very similar procedure. The way we do it definitely takes a little bit longer than the way a lot of people are doing it nowadays, but the results are consistent. Never had anybody die from it, never had any complications from it. So how the procedure is done really makes a big difference in safety as well as results.
Doctor, you and I talked a little bit before I put you on the camera here, and you educated me. I'd like to get some information from you about the difference between a plastic surgeon and a cosmetic surgeon.
Yes, major difference. So most people don't realize there's a difference because plastic surgeons do cosmetic surgery. We train in, our name is plastic surgery, but we train in numerous different parts of plastic surgery, of which cosmetic surgery is one of. So people use that term interchangeably for plastic surgeons. What most people don't realize is that the doctors who call themselves cosmetic surgeons are usually not plastic surgeons. So to become a plastic surgeon, you go through college for 4 years, med school for 4 years, usually general surgery for 3 to 5 years, and then 2 or 3 more years of plastic surgery training. To become a cosmetic surgeon, you have to train in something. You graduate medical school, you do 1 year of internship, you can do cosmetic surgery. A lot of OBGYNs, dermatologists, ENTs, family practitioners, general surgeons, even orthopedic surgeons, a lot of them give up what they trained in and start doing liposuction and tummy tucks and other procedures as well, including Brazilian butt lifts.
All right, so Brazilian butt lifts. What, in your view, is a proper procedure to effectuate that surgical procedure? The women want to have a larger buttocks. Is that correct?
Larger, fuller, nicer shape. I mean, some people are blessed with a nice full round buttocks, and many women are not. So just like breast implants for years, women who have flat chests wanted to have something. A lot of women who have no butt want to have something. And then there's no question, certain ethnicities tend to want a much bigger buttock. So African Americans and Latinos typically, traditionally have had bigger butts, and those who don't fit in with that crowd, who want to have a bigger butt, typically come in to get it made bigger.
Okay, and so when that patient presents to you, what is the procedure, in your view, that is correct to do that surgical procedure for them?
So first of all, Brazilian butt lift, basically what that means is we're taking fat off your abdomen, your waist, your flanks, so people call it lipo 360 all the way around the waistline. So removing fat. What most people don't realize is about fat. Most people think of fat as what you see in food. Grease, oil, butter, that's fatty acids, triglycerides, cholesterol. That's what stores inside of your fat cells. So when we're doing this procedure, we're removing fat cells. We can take them from one part of the body and put them into a different part of the body. So we're transplanting these cells, we're detaching them from their blood supply, we purify them, clean them up, get rid of any oils, any dead cells, any serum, tumescent solution, blood cells, and just give you back pure, live, healthy fat cells and stem cells. So we transplant them to your buttocks. We inject them throughout all the soft tissue of your buttocks. Then your body's got to regrow new blood vessels with each one of them. So we want nice, healthy cells. And the other thing most people don't realize is you don't make new fat cells. So wherever we take them from, they're permanently gone. When you gain weight, your fat cells get bigger. When you lose weight, they shrink. You don't make new ones, they don't go away. So wherever we remove them from, you're permanently smaller. Wherever we put them, you're permanently bigger, as long as they survived. So the technique to remove the fat cells makes a big difference in the results. The technique as far as how they're purified makes a big difference, as well as how they're injected. And then the last thing is always what patients do afterwards. So there's a very strict routine that we follow in the operating room as far as how we take the fat cells out, how we purify them. I use a centrifuge, which gets rid of all those other things and comes up with pure, live, healthy fat cells and stem cells. Some docs just take whatever comes out of your body, flip you over, and shoot right into your buttocks. When you're doing that, you definitely lose a lot more fat cells. And also the other issue is how the fat cells are removed, which type of machine you use. So I use just standard old-fashioned liposuction, tumescent liposuction, which means we inject fluid first. helps to minimize any blood loss. We suck the fat cells out, purify them, put them back in. There are other machines like ultrasonic machines, and there's numerous different names of them, and laser machines which have numerous different names as well. Those two machines basically have been used for years to make it easier on the surgeon to remove the fat cells, and because they may cause a little bit of skin tightening as well. But they also cause more burns. I've seen patients come in who have had this done elsewhere who have burns all over their belly. I've seen patients come in who are just totally numb in certain areas from damage of nerves. Again, the complication rate for these machines is much higher because they're heating things. So you first put a laser in and burn all the fat cells. You're also burning some blood vessels. You can burn the skin. Ultrasonic, the machine actually emits an ultrasonic wave which cavitates the fat and also creates a lot of heat and causes burns of the skin, more scars, more seroma, so a lot more complications associated with those machines.
Would you say that using those machines or those devices that burn is a good idea?
I don't think so at all. Number one, it is definitely killing more of your fat cells. So when you're getting this done, we want all those fat cells alive. This machine is damaging fat cells, killing some of them are damaged, and you transplant both the damaged ones and the killed ones, you're just not getting as good of a result. You're not getting as much fat.
All right, I know, doctor, that you're aware that there are numerous clinics and offices and such in Florida, in this country particularly. And you, of course, as a practitioner, one of the leading practitioners in this field, one of the two first doctors to do this procedure. Do you have any thoughts on the Florida practice as, in a general way? I'm sure there might be some physicians who are doing this completely properly in Florida, but what is your understanding of what's going on, if you will, in Florida in particular?
So this is what's known as medical tourism. So for years, again, since I was one of the first two docs in America doing this, we had patients flying in from all around the country and all around the world to get this done. Now, Miami has kind of become the mecca of BBLs, so a lot of patients are flying down there to get it done. Number one reason, it's very cheap. So they do the whole procedure for about half or less than half the price of what most docs in the rest of the country do it for. So it's a very cheap procedure. They get you in, get you out. In most cases, you do not meet the surgeon until the morning of surgery. So I've had many, many patients who have had this done down there who come back to me afterwards to get things redone or to fix the complications or they've got infections. So basically they have a salesperson or maybe a nurse who will talk to you on the phone. They tell you to send your pictures down to them. You meet the surgeon the morning of surgery. They do your surgery. You might see them once afterwards if you're lucky, or might see a nurse once afterwards if you're lucky, and then you go back home. So when we were doing this, or when we still do this for patients who fly in from all around the world to get this done, we have them spend at least 1 month in this town here to be sure things heal well and to make it safe for them to fly back home. So another big issue is when you have surgery, there's a risk of getting blood clots. When you have surgery and then get on an airplane afterwards, your risk of blood clots getting on that airplane goes way up. So your risk of getting blood clots, which can kill you, is pretty high for the first 2 weeks. 3 weeks better, 4 weeks you're back to normal for that risk. So we wouldn't let anybody leave town for a month after getting a BBL, just because of that risk of flying afterwards. So again, these docs do the procedure in about 2 to 3 hours. We've had, I have friends who are plastic surgeons down there as well. Most of them do it in a very precise way, a longer way, but there are just factories down there. They get you in, get you out, move on to the next patient. I know one place down there does 6 of them a day, which for me, doing a BBL takes at least 6 hours on average. They do the whole thing in 2 to 3. So they want to get you in, get you out, move on to the next patient, and they never see you again.
If it's fair then, listening to you just now, I would imagine that your recommendation would be potentially avoid Florida, and certainly by all means, if you find a good physician in Florida who should be a plastic surgeon, then that might be okay. But otherwise, I'm hearing that you're not really in favor of these tourist facilities and the potential for the health of these individuals women who might go to these places.
Correct. I mean, I think medical tourism, if it's done right, is okay. But again, the factory lineup, get them in, get them out kind of deal, just in my opinion, is very unsafe. Again, the machines they use, I think make it even more unsafe. A lot of them. Not everybody does it that way. There's no question some docs down there do great work and great jobs. But again, I'd make sure they're a board-certified plastic surgeon, and I'd make sure that they are the one doing your surgery, not some other medical doctor or cosmetic surgeon that they have hired to do the surgery.
Dr. Markmann, thank you so much. Indeed, what you have offered is highly important, highly educational.
You're very welcome.
anyone watching this video, please, if you're considering having a BBL procedure, take to heart what this fine doctor is telling you. If you know somebody that's considering it, make them watch this video. I'm going to go so far as to, even when this is over, I'm going to put up Dr. Markmann's contact information so you can at least consult with him before you decide to have someone work on you. I think clearly the takeaway from this is you want a board certified plastic surgeon doing your surgery, and probably best just to stay away from Florida's practitioners. If you or someone you know has suffered a burn injury because of the malpractice or negligence of a doctor doing this procedure, I'd be honored to be able to talk to you. My contact information also will be following this video. Please be safe. Thank you for watching this.